let's just go to Dr. Kavanagh right now and find out what is the latest. And Dr. Kavanagh, good morning to you, sir.
Oh, good morning, Jack.
My first question to you this morning is, what is wrong with Dr. Fauci's voice?
Well, I'm not sure. It's a little gravelly, but it could be that he's always having to argue with the administration, but who knows?
You're right about that. And yesterday's little confrontation with another doctor, Dr. Senator Rand Paul, what do you think about that?
Well, I really didn't agree with some of the premise of Dr. Paul, although I will admit when he said you'll get immunity in the short term from this, I think that is correct. I've always been concerned of what happens a year, 2 years out, where I think with the coronavirus, similar to a cold, you may get reinfected. I do think that you also need to look at disability and the long-term effects of this virus that can occur in a few individuals. And this is also a concern. And if you're going to get the economy open, you have to make the people feel safe. And this is the key. And you don't do this by encouraging people not to wear masks. And you do encouragement by setting an example. And so I think that's very important. I mean, that's what they're doing in the White House now. I want to be treated the same when I go into a retail establishment as I would if I went into the White House. If I have a meal or I have a meal prepared for me, I want to make sure that the people preparing it are wearing a mask. Other people in the building should be wearing masks. And I think that that's very important to restore consumer confidence. If that's not done, I don't think we'll see a reopening of the economy. You can say it's reopening, but it won't necessarily reopen. I should add that if you look at Sweden, and everybody likes to compare to Sweden, well, their Sweden Central Bank feels that they'll be taking a 7 to 10% hit in their GDP. Because again, people there don't necessarily feel comfortable doing all the activities they did before. And you need to remember that in Sweden, they're still not gathering in groups greater than 50. They're discouraging travel within their country. I mean, they're not completely open as they were before this.
Very interesting. Something I don't think you have made comment about on this program anyway is PIMS, the pediatric inflammatory multisystem syndrome that we're starting to see in the United States.
Well, and I think the biggest take-home message from this is that we just do not know that much about the virus. I mean, who would have predicted that 4 to 6 weeks out, a very small percentage of children, very small now, will get severely sick from this? So this virus is really not just a respiratory virus where it affects your lungs. It affects multiple blood vessels, multiple organs in the body, can give you clotting. You've heard about the rare problems of strokes. Again, very rare. The vast majority of people do well, but when you calculate in and you start your talking points and you're just talking about deaths, you're not telling the whole story. You also have to look at some disability and long-lasting health problems. Now, how long do they last? Who knows? We've only been fighting this virus for a couple of months. But things such as pulmonary fibrosis or scarring of the lungs, which can occur when you're on a ventilator, that would be expected to be lasting a long time, if not a lifetime. But again, you have to be very sick to develop that frequently. Those are typically rare complications, but still you have to look at those.
I know there are other long-term problems in survivors of severe diseases are now being reported. What do we need to do in that regard?
Well, that we need to do careful monitoring. If you're hospitalized and you do wind up in the ICU, again, as I said, you can get pulmonary fibrosis. If you're just hospitalized, you're sick enough to be at risk for developing some heart damage. Whether or not that's reversible, we just do not know. Number of patients who get severely sick have to be dialyzed. So there are a number of factors that go into this disease, and also the treatment of those factors requires you to have a functioning medical system. And that's why if you overrun this system with COVID patients, as some people advocate doing, your death rate will just shoot up. And as I've discussed before, immunity is not assured. That's still unknown. And especially when you look at 1 to 2 years out, you could be susceptible to getting the virus. And of course, there's a second strain, and whether or not there's cross immunity to that strain, which affects the little spiky attachment protein, that is a big unknown also. So a lot we have to learn, but I think as you follow these discussions and these segments, what we're learning about the virus has progressively been this is more and more of a dangerous type of a virus, and we need to take it seriously. And seriously means wearing masks in retail establishments. Food preparers need to wear masks.
Dr. Kavanagh, always a pleasure, sir. Thank you very much. We'll talk to you on Friday morning.
All right. Thank you, sir.